Okay, I did my review on narcissistic personality disorder. I wanted to know, is narcissism completely uncurable? If you do hear kids, I have 4 kids upstairs, so that's what you'll hear in the background if you do hear anything. Um, I just found it really interesting that something was uncurable that was a mental disorder, and I really wanted to get into that and learn more about it. So the history of narcissism, it's based in Greek and Roman mythology. It was in Greek mythology, but Ovid of ancient Rome actually wrote about Narcissus first. It was a epic poem called the Metamorphose, and he basically said that Narcissus was an attractive young man who wandered the woods looking for an ideal partner. He had many suitors, and he just couldn't find the one that was perfect for him, uh, because his love of self was so great. He even had someone named Echo. She was the most famous because she would just repeat everything that he said, but she was also not good enough for him until he stumbled and saw himself in a pool of water. And he actually eventually became frozen there because he fell in love with his own reflection. So he died there, and in his place, a flower grew, which was a daylily, which today we call the Narcissus daylily. So, some of the really ancient and old allusions to narcissism is Byron, in the start of the 19th century, used the term describing how self-love forever creeps out like a snake to sting anything which happens to stumble upon it, which shows the negative connotation that people had with it even in the ancient times. Baudelaire wrote, as vigorous a growth in the heart of natural man as self-love, as well as, like Narcissus, of fat-headedness, are contemplating the crowd as though it were a river offering them their own image. There's narcissism throughout literature, especially classic literature. I put a couple in that I've noticed, and then I found some on the internet. Sons and Lovers, Mommy Dearest, which women and men exhibit different traits due to gender roles, socioculturally. There's East of Eden, Flowers in the Attic, Moriarty in Sherlock Holmes. Some say Sherlock Holmes. Middlemarch, Dorian Gray, White Oleander, Ulysses, The Great Gatsby, Madame Bovary, Casanova. These are just a few. There's also narcissism in film, obviously, if it is in literature. It's part of our culture, so some of them are American Psycho, which you could argue that it's a psychopath, obviously, but many psychopaths, part of being a psychopath is being narcissistic. Hitchhiker's Guide to the Galaxy, there's Zoolander, Basic Instinct, Gone with the Wind, American Beauty, The Godfather, Mermaids, Mean Girls, House. So the history of narcissism as a disorder was first emerged in 1898. Havelock Ellis linked that Ovid poem to the condition of autoeroticism in one of his patients. So he didn't connect the eroticism of self with narcissism that we know today. His depiction was more about pleasure than a psychological condition. And our Ernest Jones in 1913 was the first to construe narcissism as a character trait, which he called a God complex, like a megalomania. He described people with God complex as aloof, inaccessible, self-admiring, self-important, overconfident, autoerotic, and exhibitionist, with fantasies of omnipotence and exhibitionistic omniscience. He also observed that these people had a high need for uniqueness and praise from others. And this is actually remarkably close to the definition that we use today. Sigmund Freud was probably the main voice of narcissism. He's the father of psychoanalytic thinking. So he described narcissism as a self-eroticism or mature self-gratifying sexuality. That was a diagnostic that's not now a criteria. So Freud started using the term ego libido and narcissistic libido interchangeably in his 3 essays on the theory of sexuality starting in 1905. In 1914, he wrote the essay on narcissism, and that's pretty much one of his main narcissistic works, or on narcissistic personality disorder. Narcissists have 2 fundamental characteristics, according to him: megalomania and diversion of their interest from the external world, and that's from people and things. The libido that has been withdrawn from the external world has been directed to the ego, and thus gives rise to an attitude which may be called narcissism. So basically what he said, our infants are born narcissists, which some psychologists and practitioners still believe today. And according to Freud, all of us bending to their every whim. They are also have an innate libido to preserve our species, and an innate ego, which works as self-preservation. At the point they become self-aware and aware of the world around them, they realize that they can't constantly get and have things their way, so the self-centeredness wanes with these realizations in normal development. In narcissism, the libido and ego are turned inward towards themselves due to the lack of care and support from their caregivers. He most notably says the mother themselves. He believes that the callous, cold, and uncaring nature of a narcissist is a defense mechanism for not receiving adequate affection, care, and love as a child. He says that whoever loves becomes humble. Those who love have, so to speak, pawned a part of their narcissism. So if you are unable to love people fully, you are unable to be selfless. He also believes that narcissism could be hereditary in nature, pointing out if we look at the attitude of affectionate parents towards their children, we have to recognize it is a revival and reproduction of their own narcissism, which they have long since abandoned. Freud again visits the subject of narcissism in his essay of libidinal types and reiterates some of the same sentiments in that as well. Robert Walder, in 1925, Walder published the first case study of someone with a disordered narcissistic personality. He describes the narcissist as condescending, feeling superior to others. He exhibited a lack of empathy, and his sexuality was based only on physical pleasure, not emotional intimacy. Wilhelm Reich, in 1933, described a phallic narcissistic character in his book Character Analysis. According to him, narcissists possess an attitude of superiority, are confident, arrogant, provocative, resenting of subordination, and mildly sadistic in their relationships. He equated these traits to extreme masculinity, and used the word phallic to describe its ultra-masculine connotations. It says the identification between the ego as a whole and the phallus. This was basically only thought to be in men. So we learn now that there are women narcissists. They're just at a much lower rate of prevalence, as well as they exhibit more strongly different traits than a man does normally in sociocultural norms. He was first to recognize that if the narcissist's ego was threatened, that they would show aggression and at times rage, called narcissistic rage. And this was the first time that someone had actually highlighted that narcissists have a narcissistic rage if they feel that their vanity is offended, as he would say. They would react with cold disdain, marked ill humor, or just downright aggression. And a side note to that is that most research is done only on white males in college at this point. So much of the psychological research is skewed towards that demographic. So it ends up just scratching the surface of the disorder. So even though the prevalence of a male only or mostly male disorder could be skewed to that because of the research cohort or population. Karen Horney and Anne Reich in 1939 and 1960 suggested that narcissism is not a disorder itself, but a maladaptive character trait that's learned. So they didn't believe in the hereditary or genetic connotation of narcissism. They felt it was learned and it was a reaction to a traumatic upbringing, something that you weren't born with. Heinz Kohut felt similar to Freud that narcissism was a natural part of the development process, which I didn't mention with Freud, but they both said that it's neither pathological nor obnoxious, that some slight narcissism is good for the patient as a whole. It's a self-preservation. He goes on to say that narcissism becomes detrimental when psychological trauma disrupts that process, that the most primitive and narcissistic version of the self remains unchanged. So emotionally, you are that primitive infant emotionally. Kohut called such conditions narcissistic personality disorder. He was the first one to coin that term. In which merging with and attaching from an archaic self-object play the central role. Narcissistic union with the idealized self-object. Kohut also offered ideas in the sense of reform and therapy. He actually went into the therapy itself. There aren't a lot of therapeutic models on the subject of narcissism. Personality disorders are extremely hard to treat. So he's one of the first to give a therapeutic model where the therapy for unhealthy narcissism should involve a process of mirroring, where the therapist first affirms their sense of grandiosity, then guides them gently and supportively toward an acceptance of their limitations and a realistic self-worth. So basically, he said to be their mirror, to give them positive reinforcement as to not wound them so that they show aggression or have some sort of wound to their vanity. Kernberg was a psychoanalyst and professor of psychology. His name was Otto Kernberg. He had a unique perspective that is used in psychiatry today. He grouped narcissism with borderline personality disorder. He felt that they were extremely close together, which now, obviously, we know cluster B personality disorders are put together in the DSM with narcissism, borderline, histrionic, and antisocial personality disorders. The kind of common theme with these disorders are that someone is dramatic, emotional, erratic, and extreme. They're at two different ends of the spectrum at any given time, and they kind of oscillate between those two. He believed narcissism was a trait as well. He believed it was infantile narcissism, that it develops into a healthy self-esteem. Uh, it is healthy due to being regulated by the ego and the superego. And that is normal adult narcissism. Everyone that has that normal adult narcissism, it is a positive personality trait. If the development between those does not occur between the ego and the superego, then it becomes pathological narcissism. It has 3 subtypes according to Kernberg, which is regression to the regulation of infantile self-esteem, narcissistic choice of object, and narcissistic personality disorder, all occurring due to developmental abnormalities of infancy. And Kernberg also went into a therapeutic model. He completely disagreed with Kohut. Kernberg thought that therapists should be neutral towards narcissists and not mirror their self-admiration at all. He believed they needed to keep a strong front and to keep the narcissist in check and accountable for their narcissistic and grandiose, inflated personality. There was also Christopher Lasch. He was actually a historian. He, in 1979, chronicled history through the lens of narcissism. In the book, The Culture of Narcissism, his account was bleak. He described modern-day society's common traits as dependable on vicarious warmth provided by others, combined with a fear of combined with a fear of dependence, a sense of inner emptiness, boundless repressed rage, pseudo self-insight, calculating seductiveness, intense fear of old age and death, altered sense of time, and fascination with celebrity. He deemed our era the rise of the narcissistic personality in middle-class America. He basically blamed the changes in our society due to the changes in work, education, institutions, the economy, and it's just basically the overall shift beginning in the early 80s of priorities in our culture. So when I speak of narcissism, it's a broad range, meaning that it's a trait. A personality disorder is an enduring pattern of inner experience behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has the onset in adolescence or early adulthood, and is stable over time and leads to distress and impairment. So it has to be stable, the symptoms. And they have to have the 3 Ps, a lot of people say in psychology, which is these disorders are patterns of behavior that are persistent over time, pervasive across people and situations, and pathological, which means they're clearly abnormal. And when I say that, the trait of narcissism itself can be viewed as positive. Kohut, Freud, many others argued that some narcissism is actually a healthy trait, and confidence in self is key to happiness. So self-sufficiency, leadership, self-assured, extroverted, risk takers, innovative thinking, having high life satisfaction and low rates of depression are all linked to narcissistic traits of a personality. So narcissistic personality disorder became an official disorder in the DSM in 1980. And then DSM is just the publication for the classification of mental disorders. The criteria was extremely influenced by Kernberg. The drawback of the DSM criterion is that it seems to pathologize all expressions of narcissism without considering the normal aspects of it or its development. Freud, Kohut, and Kernberg all saw some expressions of narcissism as important and adaptive part of a healthy psychological development. So when it's on a continuum, where within the continuum does it come? or does it become pathological? So the DSM criteria is that it has to be a pervasive pattern of grandiosity in fantasy or behavior, need for admiration, and lack of empathy beginning in early adulthood and present in a variety of contexts. And it has to have 5 or more of the following: has a grandiose sense of self-importance, is preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love, believes that he or she is special and unique and can only be understood by or should associate with other special or high status people, requires excessive admiration, has a sense of entitlement, unreasonable expectations of especially favorable treatment or automatic compliance with his or her expectations, is interpersonally exploitive, takes advantage of others, lacks empathy, is unwilling to recognize or identify with the feelings and needs of others, is often envious of others or believes that others are envious of him or her, and shows arrogant, haughty behaviors and attitudes. And this is pathologic, not one or a couple of these traits or something that is just part of your personality, but you use it healthily. This is maladaptive traits. In 1979, they made something called the Narcissistic Personality Inventory, and it was based on the DSM-3 criteria for narcissistic personality disorder. It is a 40-item forced choice version. It's a diagnostic tool. It was not intended to diagnose the patient themselves, but rather to find the level of narcissism in a patient. There are 2 types of narcissism: normal or subclinical. And then there's also the pathological, or some people say overt, which is grandiosity exhibitionism. And then there's covert, which is vulnerability sensitive. And they say that that is subclinical. Narcissism exists on a continuum, as I said. So not everyone has pathological traits, which is why the NPI was developed. Narcissism has been consistently rising since the 1980s. Many believe our technological advances are bidirectional, contributing to this societal narcissism. MySpace, Facebook, Twitter, Instagram, selfies, dating sites popped up as a result of our narcissism and now fuels our addiction to our narcissism. The upswing in narcissism occurred before these advances have taken place. Americans score highest in narcissism than any other country. The relationship between personality and culture is likely reciprocal as well, with societal changes driving increases in narcissism and narcissism driving societal changes. Our modern society emphasizes positive self-feelings and specialness to young children, grade inflation, making about half of our students have an A average, while our school systems are some of the worst in the world. That's just one example of bringing up a modern society of narcissists. The epidemic, as it has been called, is not a time period effect, but a generational effect according to data. So that means that basically speaking, your grandmother can use Facebook and a smartphone and other technological advances, but has very little change in her personality and herself as a whole or tendencies. So our culture as a whole is walking the path of a more and more independent and is scarcely interdependent any longer. Interdependence gives a kind of a check on your narcissism. So as we move further and further into an independent culture, we lose the humility and checks and balances of our communities. So there are some biological effects of narcissism. There's hormonal effects. Basically, males tend to score higher on the MPI, and some people wonder if that is due to a link with high testosterone levels. Testosterone also lends to poor relational skills, higher independence, and has been linked to autism, which also has characteristics of having problems with social interactions and empathy. Males tend to score higher, so they think that that might have something to do with that testosterone aspect. A large role of stressful events in triggering physiological reactivity in narcissists. Narcissists seem to have a more severe reactivity physiologically to stress, whether it's cardiovascular or endocrine. So that is also something to look for in the hormonal aspect of narcissism. Neuroanatomical features of narcissism. It looks like there's a recent study that was shown that patients with lesions caused by removing brain tumors in the anterior insular cortex, which is the AIC, had deficits in explicit and implicit empathetic pain processing. This evidence suggests that the empathy deficits in patients with brain damage to the AIC are similar to the empathy deficits found in autism spectrum disorders, borderline personality disorder, NPD, and others, suggesting a potentially common neural deficits in this part of the brain. It was when they did scans of the brain, the cerebral cortex was markedly reduced in thickness compared to the control group of narcissists, compared to normal group of control group. The amount of empathy was directly correlated to the volume of gray matter in the insular region. Overall, patients with narcissism exhibited a significant reduction of gray matter. It also looks like they had with narcissism, exhibited a significant process and transmit signals regulating important emotional functions related to the AIC activation. It was associated with disgust, interoceptive awareness, general emotional processing, intuition, unfairness, risk and uncertainty, and norm violations. So this was all with the cerebral cortex, and particularly the anterior insular cortex. They also showed decreased deactivation during empathy. Higher narcissism scores were associated with lower connectivity between certain brain areas, including the prefrontal cortex and ventral striatum. Clinical deficit in emotional awareness is called alexithymia. It is commonly seen in conditions associated with functional deficits like autism and depersonalization syndrome. This suggests that the impaired emotional awareness interferes with normal social function in both clinical and non-clinical populations. Diminished ability to integrate information rapidly among the spatially distinct regions may underlie functional deficits in these conditions, and ultimately the inability to make quick, intuitive judgments regarding uncertain and rapidly changing social contexts. There's also genetics. They influence both social atomization and cognitive style. So narcissism and autism tend to be in the same region of the the brain, which was the anterior insular cortex, both also being inheritable according to research, which you get a biological vulnerability. Narcissism is highly correlated with monozygotic twins. There is a 92% chance that one twin will be on the autism spectrum if the other twin is diagnosed. Environmental stressors may also make narcissism and autism more likely. Most all professionals agree that the development of narcissistic personality disorder needs environmental factors as well as genetic predisposition. Most think that this is the child-parent relationship in infancy. It's traumatic disappointment in the admired adult that they turn inward and direct all their love and admiration to their idealized self instead of outwardly loving people. It's a disorder of dismissing and preoccupied insecure attachment. Many cluster B personality disorders are disorders of interpersonal relatedness. And most narcissistic narcissistic personality disorder patients have a core pain that they use and carry with them to not be able to fully empathize with others. So the therapy and treatment of narcissistic personality disorder is very limited. There is psychoanalysis, interpersonal therapy, cognitive behavioral therapy, cognitive analytic therapy, schema therapy, and dialectical behavioral therapy, which is DBT. All of these are used. I'll just go through them really quick. But the main problem with narcissism is that if there is no relationship with the narcissist and a trust between the therapist and the narcissist, then there is no way to fully help them to realize that their personality traits are maladaptive. Kernberg has established the Cornell Personality Disorders Institute. Typical patients of NPD that he had, one was a mental health professional in a small town. As therapy progressed, he became threatened and paranoid due to the maladaptive traits being brought to his attention of his personality, and he spread derogatory comments about the practitioner in the mental health community. Another narcissist labeled thick-skinned bought a course of CDs to train therapists, and during each session he just questioned at length and intervened every step of the way in the effort to provide him therapy, and he devalued the therapist and the therapy as a whole. A narcissistic patient fluctuating at a borderline level perceived the therapist as showing sarcastic and depreciatory behavior against him, so he acted extremely derogatorily and hostile towards the therapist, and it actually ended in physical violence. And suicidal narcissistic patients actually revel in the shock of their behaviors, and they enjoy to get a reaction of others and are not in the touch with the part of themselves that wishes to die, leading to outrageous parasuicides of cutting their own fingers and tendons off, setting themselves on fire, and ingesting poison over and over. So why does therapeutic intervention fail? There's no solid treatment outcome studies on NPD. There's no large subset. If you think you're better than other people, you have high self-esteem, you are happy, why would you go and be clinically diagnosed and seek therapy? Treatment depends on the relationship of the practitioner and client. Narcissists do not relate interpersonally with people, and they cannot keep relationships with which hinders their treatment. Narcissism is a response to trauma. and could be a degree of detachment to survive that trauma. So they might not even be able to see why they have these certain maladaptive traits, and they might not even remember the trauma because they are so dissociated. Envy and contempt for the therapist, wanting to help them, or pointing out their faults, can backfire with the patient ending therapy. Contempt can end in violence, which also ends therapy. Their grandiose and omnipotent beliefs prevent any progress or impact of therapy, and their intolerance of triangulation is part of an object relations theory, in which a severe regression doesn't allow the patient to tolerate any thoughts different from their own, thus making therapy impossible. So my main solution to is to have large-scale research to narcissistic personality disorder to treat it. We need more large-scale research, even if it's on subclinical narcissism. Something is better than nothing. Therapists need to have in-depth diagnostic evaluations with narcissistic patients. They need to get a feel for what type of narcissism is present, and then they need to pick a therapy based on the patient, not on their school of thought that they follow, not psychoanalytic, not dialectical behavioral, not cognitive behavioral. You should tailor make it to each patient. I'm sorry it was so long. That's my presentation, and thanks so much.